Good morning, good afternoon, good evening. This is Dr. Garais for MED120 Medical Terminology, Week 9. And this week's lecture is Integumentary System, your skin. So let's go to our textbook. Let's find Integumentary System. Now, I don't know why they put it last, but typically integumentary is one of the first things that when we speak of anatomy and physiology, we talk about, but for whatever reason, it's a little bit out of order. So let's look at the integumentary system. And again, we always start with the specialties, and the specialty of MDs that deal with dermatology, deal with the skin, is the Department of Dermatology, Logi, study of dermat, skin. And the skin is not just a simple covering; it is your first line of defense for pathogens or things that can make you sick. And you can see there's multiple layers, and there's sensory in the form of nerves. You see these yellow things are nerves, arteries and veins, and the arteries are colored red, the veins are colored blue. They are not colored like that in real life. Those are just conventions utilized for diagram purposes so that everyone's on the same page of what we're all looking at. It also hair also includes nails and skin and hair. Okay, and if you look at the layers, epidermis, dermis, and dermis is another word for skin. Epi, it's the layer that's on top, and your subcutaneous. Cutaneous is another word for skin. Sub, underneath, where it has a lot of adipose tissue or fat. But this is a nice picture when you're in anatomy and physiology, and also it also then shows you, you know, the importance of medical terminology regarding how it's going to help you in anatomy and physiology and other classes. So let's look at some of the combining forms. Adipo and lipo and steato. What are these figures? Okay, good. Got rid of that. This is a beautiful all of the above question because all of these combining forms mean fat. An adipocele is a herniation or a swelling of fat. Adipocyte is a fat cell. Little side note regarding your fat cells: you could take lipo all you want. If you don't curb your diet or curb your lifestyle, you'll gain all the weight back because the funny thing about adipocytes or fat cells is that, yeah, you can remove the number of them, but the ones that remain will compensate for the ones that are missing if you keep on eating, because the sole purpose of a fat cell is storage, right? So if you get rid of the boxes that you leave behind will get bigger. So it's any of you considering liposuction, which brings us to the next word, lipocytes, which is another word for fat cell, and liposuction. What were we removing? We're removing fat. Steatitis, that's when the fat gets infected, right? Because just like the skin, you can have dermatitis. Well, remember, we just looked at that picture a second ago. The lower levels of skin have fat. That could also be infected, and then you'll get steatitis. Cutaneous, dermat, dermo, they all mean skin. Subcutaneous, underneath the skin. Dermatology or dermatologist studies skin. And a hypodermic needle has to go under or below the more superficial sections of skin, and it's the reason why a hypodermic needle, right, has to be at a 45-degree angle and upon insertion in the skin, and you'll learn that when you get into your clinical classes. Sweat's really important. It not only cools your body down, it also gets rid of some wastes, and too much of a good thing becomes a bad thing. So if you have pseudoresis, profuse sweating, also known as hyperhidrosis, which utilize both of these combining forms. That profuse sweating, two things. More common, it's probably reaction to a high fever. I mean, high fever, like I'm talking 104, 105 degrees Fahrenheit, or it could be a sign of neurologic disorder. Hydradenitis, itis, inflammation or infection. Hydra, the sweating, and adin, which is gland. So the sweat gland can easily get infected, um, and it happens a lot in people who have like acne vulgaris and stuff like that. Ichthyosis, osis, abnormal condition. Ichthy in Latin means fish, so dry, scaly, scales like a fish. So that's ichthyosis. Keratosis. Keratin is what makes your skin and nails strong, but too much of a good thing becomes a bad thing. And keratosis is the abnormal condition where the more upper layers of your skin start getting really hard, um, and usually gets followed by itching. Melanocytes are the cells that give you your color, right? So the more melanocytes you have, the darker your skin is, and it's a protective function for UV radiation because people who have genetics that are from places near the equator of the Earth, in the more tropical, more hot areas, the sun, the UV radiation is a lot higher than people who live like closer to the North or South poles. And that's why people who live like up north, they have blonde hair, blue eyes, because they don't have a lot of melanin, right? So those people, if ever they're exposed to a larger amount of UV radiation, that becomes a risk for skin cancer. But those people who have darker skin, darker eyes, darker hair, they have a lot of melanocytes, so it's a protective function. So people, Caucasians, people of lighter skin, lighter color eyes, lighter color hair, they're great. They have a greater predisposition to a melanoma, which is a tumor of your melanocytes. Myco is fungus, dermatomycosis. Get a fungus. Most common place is your nails. So, ladies and gentlemen, if you're at the nail place, make sure they have all their certifications up by the Department of Health, and actually, I believe nail care in Virginia is still under the Board of Nursing. I can't remember them and massage places because they have to be clean, and if they don't clean the utensils regularly and stuff like that, you could get a fungus, dermatomycosis. Now, onychomalacia, softening of the nails. Excuse me. Got a little frog in my throat. Onychomalacia. Onycho means nails. Malacia is abnormal softening and malformation of your nails, and that's not good. And nails have to be hard. And remember, we just talked about keratin, which is a very important protein that keeps our skin and nails and our hair tough. Hair pylo. So a needle cyst is a tuft of hair uh, in a cyst. Also, it could be in a dermoid cyst. Oid, it's resembling the skin. It's not skin, but it looks like it. Trichopathy is pathy, disease. Tricho also means hair. Or trichosis, it's abnormal condition of hair. Um, Sclerosis, again, an abnormal hardening. Scleroderma, you could have an abnormal hardening of the skin, and it's chronic, means ick, pertaining to time. It's progressive, and I don't. Actually, I'm not quite sure if it's progressive, but it's a disease that you're going to be living with for a while. And ick pertaining to Crohn time. Something that's acute happens, quickly. But something that's a chronic disease happens over extended period of time. Sebum is oil. You have oil in your skin, and your skin gets oily, and your hair gets oily to keep it soft, and also to keep it waterproof to an extent. But too much of a good thing becomes a bad thing. So seborrhea also is common, and then um, it can lead to also infections because then everything gets kind of gummed up from the oil. Squamous, us, pertaining to scales, and your squamous cells are. Let's look up to the top real quick. Oh, they don't really show it here. Your squamous cells are on the top, and squamous cells is they're flat. They're like little scales, little shields. Let's show you squamous cells. Oh, that's cancer. I don't want to. Why do they go directly? Such a pessimistic Google. Uh, I just want the skin cells. Skin, normal. I think that's the best thing there. Which is a good one? Which is a good one? Here, epidermis. Let's look at this. Okay, here you go. Do you see here? This is, of course, your epidermis, right? We talked about melanocytes. They're the ones that'll give you your skin color. Keratinocytes that'll give you make this hard, right? But if you could see here, you see how they're all layered and they're all flat. These cells, those are squamous cells. Here's another diagrammatic. See how they're flat? Those are squamous cells. And then you got your basal cells, or your, I like to call them basement cells. They're the so you could get BCC, basal cell carcinoma, right? Oma, tumor, cancerous tumor, carcin. You could get melanoma, which could be benign. It also could be malignant, right? You could also have squamous cells carcinoma as well. So anytime you got a cell, you can have cancer, because all that cancer is a cell that just doesn't know how to quit, a cell that keeps on multiplying, and for no good reason other than just to multiply. And we all know what happens when you have a copy of a copy of a copy. It becomes useless. It's just taking up space. It's eating up resources, and and what happens when you have a whole bunch of cells in a place? It'll start breaking down the walls, breaking down the ceiling, breaking down the floor, and you're gonna have a whole bunch of other problems. Xeroderma, again, chronic dry skin. It is a mild form of ichthyosis, so they're kind of similar. Derma, pyoderma, you could have a pus. And just as a quick review, all that pus is white blood cells and a whole bunch of dead white blood cells and a whole bunch of dead bacteria or other pathogens. And you could see you could see how we have to get rid of that, because dead things beget more dead things in the human body. So when a piece of your skin dies, it's going to send a message to the other skin around it. Hey gang, it's time to die. And that's tumor necrosis factor. Necrosis, osis, abnormal condition of death. Now, that's bringing me to another topic. Osis, abnormal condition, necker, death. Now, there's normal death, right, which happens, like, for example, red blood cells. They typically die within 120 days. That's their life cycle. That's normal. And then we get new red blood cells. But if let's say you scraped your knee real bad. If ever you look at the wound after you even after you clean it, there's little black edges to the wound. You got to clean that as well because that's called eschar, ESCHAR, and that's necrotic tissue. That's not good, and that's why if ever you've been in an emergency room, they'll really scrub your wound clean because we really need to get rid of all of that, and you could get a pyoderma from that, and that's not good. Dermoid, we already talked about. Oid means resembling. So lipoid, a lipoid tumor is not a tumor of fat. It's a tumor or a lump or a bump of something that looks like fat. Phoresis, diaphoresis. Dia means complete or thorough, right? I use that from a previous definition of this textbook. A couple of textbooks ago, they changed it to through or across, but through or across means trans. So dia means complete or thorough. So complete or thorough sweating. And again, diaphoresis could mean two things. You're having a neurologic or you're having neurologic signs and symptoms of something, or most likely, especially when they use this term diaphoresis, you have a high grade fever that just broke. And you know when you break your, those of you who've ever had a high grade fever and your fever broke, you start sweating profusely, and I mean sweating, as in 10 seconds your shirt will be wet like someone poured water on you. Plasti, of course, is a process of repair. Dermatoplasty is surgical repair of your skin. Therapy, cryotherapy. Cryo is cold. We use um, we use these chemical sticks. So if you see them, let me see if I can have a picture of it. If you see these chemical sticks, do not touch them with your hands. Let's see. See what's okay. Here are ones where they come in freezing sprays, and they come in these uh they come in these little match head like things like this. Um Let me try to find a better picture. Well, I remember them. They look like matches, right? And they do not touch them with your hands because the second it contacts skin, it gets really, really cold. And we use that like to kind of like burn off unwanted skin lesions. So be careful that I once I once was I did something silly and I didn't wear my gloves and I got burned. Got a cold burn because of it. Plasti therapy, cryotherapy. So we use this extreme chemical cold as a destructive medium, and we use it for warts and for keratosis, things of that nature. But I just remember it. It looked like a matchstick, so I didn't think anything of it until it did what? Until it burned me, which wasn't fun. Okay. Here, utilize your textbook for future reference. They have these nice little games you could play here, and also online has similar games that you can do regarding anatomy and physiology. It's this. Oh, liposuction, areas of liposuction. And by the way, if you've ever seen a video of liposuction, it is not pleasant, and it causes a lot of trauma, and it causes a lot of pain. And the pain doesn't end after a day or two. It's like weeks. Here's your nail. It's nice. Oh, let's look at this. This is nice. But I believe my week one or week two notes that I shared with you guys have this as well. This is the medical terminology of color. So albinism is when there is absolutely no melanocytes in this patient. So they're gonna have like stark white, like bleach white hair, and very very light blue eyes, and their skin's gonna be very pale. and that means this person cannot be exposed to any UV radiation like the sun. Cyano means blue, and for a person of color, it's when the person turns like kind of ashen or ashy, a grayish. Um, but ultimately, cyanosis, abnormal condition, uh, um, the skin is not normal color, and it happens when there's hypoxemia. Hypo meaning decreased, emia, blood condition, and ox, of course, oxygen. Erythro, erythroderma, it's when my patients flush. Either they're embarrassed or they have a mild inflammatory process going on. Leuco means white. Leucoderma. You may have heard of the term leukoplakia, which is you get this white growth on your tongue. Milano we already discussed, and xantho is yellow. Xanthoma usually means it is some sort of tumor, most likely fat, and that's a xanthoma or a xanthoderma. All right. Oh, what happened here? Oh, what's this? Correct response. Oh, examples. Oh, I guess accidentally. Oh, that also reminds me. You could use your textbook as a quiz, but the thing about the textbook is it doesn't save anything. But my advice is screenshot, and then you could study it that way. Or what I've been doing for you guys all along, make mini quizzes. And again, back to why mini quizzes. Train like you are to fight. If you're gonna have a multiple choice examination, you should be training in a multiple choice examination format all the time. Um, I see it all the time when people take Accuplace or your T's or SATs, MCATs, NCLEX. The trick is what? Massive amounts of repetition, massive amounts of multiple choice examinations, because that's the examination. And again, it's training like the way you fight. But looking at notes all day, it's going to go in one ear, not the other, and you're not actually performing what you need to perform, which is the multiple choice format. And if you have not been trained on how to take care of multiple choice examinations and the protocol on how to do that, it's a discipline. Please give me a call, and I'll make a little mini video out of it for you, or you can Google it. I'm not the only game in town. Basal cell carcinoma, BCC, right? And you could because and I show you the it is what part of your basal cell in your epidermis, and it's an oma, tumor of carcin, cancer. Okay, and it's the deepest layer of the epidermis. That's why I call it the basement. Now metastasis, this word right here, metastasis. Now, stasis is the state or condition of standing still. Meta is change. So when you get metastasis, that means the tumor is moving, and it's moving from one place. It's moving from one place to another, and that's a sign of a malignant or a bad tumor. And it likes to travel, and if it travels, it causes damage in other parts of your body. Um, Sarcoma is a fleshy tissue tumor, and Kaposi sarcoma or KS is definitely linked to HIV and AIDS patients. And KS doesn't come out with anything else. You see KS or Kaposi sarcoma, it's a highly malignant fleshy tissue tumor, and it's your patient's HIV positive or has AIDS or is already in full blown AIDS mode. Um, Here's some abbreviations, but again, you could look at more. BX biopsy, and remember from week 1, week 2 notes, biopsy. Opsy is the process of viewing, bio life. So when we take a biopsy, that's a definitive test for cancer. There's a whole bunch of screening tests we can do, but you take a biopsy, that means I take a bite or a piece of that tumor, and then I send it to pathology, and pathology looks at it. They look at it their microscope, and then they look at the cells and they go, "Hey, that's definitely a tumor." You already know diagnosis, FH, family history, sometimes abbreviated FMH. IND is incisions and drainage. PE, physical examination. Um, Diseases and conditions. You'll learn these things in anatomy and physiology as well. Um, Abrasion, the different types of wounds. So you have an abrasion, abscess. Again, localized collection of pus. And um, if you have a furuncle, right? It's just like one. Carbuncle is like a whole bunch of them all together. Okay, and they have to be, like Doctor Pimple Popper. They have to be they have to be opened up and drained. I have to do an incision and I have to drain it, and it's an IND because it has a lot of necrotic tissue. It has a lot of dead bacteria in it, and it has a lot of dead white blood cells in it, and that goes, all of that, infection goes into your blood. You're gonna have a bad day. Alopecia, absence or loss of hair. Maybe you've heard of, and it happens for both male and female. Cyst, we already talked about. Eczema. Um, um, just know that it could be, there's a million types of eczema, and again, that's for dermatology. Hemorrhaging, um, large loss of blood, and these other stuff, contusions, ecchymosis. That's a fancy word for bruise, because all that a bruise is just a collection of red blood cells that burst open from a localized artery or vein in response to some trauma. And if you have contusions and ecchymosis without trauma or without somebody hitting you, you got some problems. And most likely, you have a blood problem, or what they call blood dyscrasia. Dys means what? Abnormal or painful. Ia, state or condition. Abnormal or painful state or condition. Um, uh, like, for example, if your red blood cells are messed up, or um, yeah, and it's essentially a bruise. Petechiae or petechia is the little dots that, if ever, what's a sign of petechia? It's also, you got a bleeding problem, or you got a blood problem. Maybe there's something wrong with your platelets. But petechia is, if you ever had somebody put the tourniquet on your arm too long, it's the little bumps, not bumps, but little dots that form on your forearm. That's what petechia look like. But if you have a platelet problem, it's gonna be all over your body. His eczema, also known as cradle cap. And this is an extreme form. My daughter had this when she was little. Ecchymosis, bruising. It's a little bit much. Someone went to town on this person. Hematoma. Now, oma, tumor, hemat, blood. Now, hematoma is not a blood cancer. Remember, oma means lump or bump, right? It just means swelling until we have the biopsy to say otherwise. And then you put the word carcin in front of it, carcinoma, that means it's cancer. Abbreviation, capital C, capital A, and you could use that in your homework. Now, but a hematoma it's just a localized, benign elevation of blood. Again, just like a bruise. Let's say your phlebotomist, phleb, vein, tomi, to cut into. Your phlebotomist, pokes you, gets some blood out. Sometimes it goes through and through, and sometimes, even if you apply direct pressure immediately, it doesn't necessarily mean that the technician or the phlebotomist did something wrong. It just means that what? Some blood got away from it, and it's going to form a little bump, right? You elevate it and you put a little ice, and it should go down. Hirsutism, that's a condition of excessive growth. So alopecia is when your hair falls out or you have deficiency of hair. Hirsutism is when you have way too much hair, right? And it's usually due to either some hormones or a neoplasm, which is another word for tumor, right, or cancer. Neo means growth. Neo means new. Plasm means growth. So anything that's a new growth that's unexplained, considered cancer. And there's certain kinds of cancers that kick out hormones that will give you hirsutism. Impetigo, bacterial skin infection, psoriasis. Now, autoimmune. Okay, auto means self. Immune is your of course your immune system. So, can your immune system start attacking your skin? Yes, in the case of psoriasis, it does. In the case of allergies, it does. Okay. Scabies, you get itches because of mites. Little mini bugs. Skin lesion, primary lesion, secondary lesion, right? I don't need to know that. Tinea, fungal infection. So a tinea is a mycosis. Okay, here's a nice picture of psoriasis. And for future reference, this is a nice thing for clinical. So you know which lesions are solid, which lesions are fluid filled, right? So a vesicle, pustule, and a bulla, right? They're like blisters and they got things in it, most likely pus. Now, things that are solid, you have papules, nodules, tumors, and wheals, right? Okay, and so this is something nice to know. Not really for medical terminology, but more for your clinical classes, which are good. And then, of course, you have some depressed lesions, right? Fissure, ulcer. Ulcer is like open sore, open hole. And all of these, uh, great point source for infection. So we have to be aware of that. Now, excoriations. The best way to describe an excoriation, you ever have a really bad rash or a really bad itch and you scratch it and then it gets cut up a little, but you scratch it some more or you scratch around it because it's still itchy and then that gets also cut up as well. That's when you have scratches upon scratches, and those are excoriations. Urticaria, allergic reaction, right? You get little, that's when you get wheals or hives. And remember, you should be able to translate layperson terms to medical terms. Okay. Verruca is a uh, benign cancer, and it's also known as a wart. Now that's a pressure ulcer or a decubitus ulcer. Now, when you rub the skin enough or you put enough pressure on it, it'll break. It'll get messed up, and that's why you always have to turn your patient. Those of you who know about turning schedules and rotation schedule, bed rotation schedules, because those of you who've slept in a bed long enough, what happens to this part of your back, your sacral area, and your heels? Right? The pressure of just gravity of you like moving around just little by little bit in your bed. For those patients who are bedridden, this could happen, and you could easily see how this opens up and it goes into your bloodstream, and then you will have sepsis, and that is a blood infection, and that'll go everywhere. So, Department of Medicine, Department of Surgery, they do a lot of preventive care, and you're always inspecting your patients. Of course, warts, and we could use cryotherapy on those. That's vitiligo. It's a genetic uh, uh, patchy loss of melanocytes. So you could be the judge. Remember Michael Jackson? He said he had vitiligo. Did it look like he had vitiligo? No, right? And also no genetic markers in the entire Jackson family. So great music, but he didn't have vitiligo. Biopsy. Here's some skin tests. Debridement. Now look at this word debridement. That's an important word in surgery, and in wound care and emergency medicine. Again, we have to get rid of all foreign material, not because it's a point source for infection, and dead material, right? Remember I told you about that eschar and all that. When you scrape your knee or get a really bad wound, there's this little black uh, tissue that surrounds the area of the wound. You have to clean that as well, and all of that cleaning we do with a brush, and it's pretty hardcore and it hurts, and that's called debridement. Eczema laser, don't need to know about that. Fulguration, we don't need to know that. But this we already talked about. I&D, that's incision and drainage. Mohs, you don't need to know about that yet. Skin graft. Well, we'll look at skin graft. Let's look at the prefixes because those are nice. So when I graft and when I do an allograft, right? Allo means other. So I'm transplanting something from either human or animal onto you. Autograph, I'm doing it for your own self. This is pretty much what we like to do, especially with burn patients. We take skin from the unaffected area and then we graft it onto the affected area. And of course, synthetic, right? Sin means the same. Thesis is something that you create. So we're creating something in a lab. And a xenograph is something that's totally foreign. Xeno means foreign, so totally foreign or totally strange. And it's just another word of saying allograph, non-human allograph. Um, Antibiotics, antifungals, antipyretics. Anti means against or to, right? Well, not necessarily kill. It's not going to kill all the bacteria, but it's going to kill most of them. Antifungals or antimycotic. Antipyretic reduces pruritus. Pruritus is severe itching. You ever have an itch you can't scratch? Well, pruritus is that times 10 and it won't go away. So we give you some medications to, calm you down because that could drive a person batty. Corticosteroids. Another thing about skin is does a lot of inflammatory process, inflammation to protect the surrounding area. But too much inflammation is not good, so we can lower that inflammation by the use of corticosteroids. Corticosteroids are drugs that release cortisol, and cortisol has an anti inflammatory action. Now, the problem with corticosteroids is they're really great of decreasing your inflammation when it gets out of hand, but the problem is it also lowers your immune system at the same time. So, know this that doctors, nurses, medical professionals, we're always constantly weighing the costs of care. What are the pros versus the cons? And when we're dealing with steroids, it's in the back of my mind. Yeah, I'm gonna get that disease process down, but I could also be setting them up for something else. We use corticosteroids a lot in asthmatic patients, but we try not to do too much. Now, you could use these cases as well for your homework. Try to find abbreviations. Okay, even for disease states, and they're typical. And again, you have uh, um, you have the most common words, and you have some nice questions you could work on. But remember, the homework is about trying to find some abbreviations. You can see that there's not too many in this particular chapter. Therefore, go out and go look and be a little bit creative as well regarding abbreviations that relate to progress notes, that relate to the minor surgery that dermatology does. All right. Okay, on that note, that is week 9 items. Please look at the announcements as well regarding final exam. And if you have yet to register for your term 3 classes or your next term classes, please do so. Again, this is Dr. Garais signing off. Thank you very much.